Here, take some Robifen for your cough.
Robifen works by suppressing the cough reflex at the cough receptors. It dries out the secretions of the mucosa, thus reducing nasal drip, and has an analgesic effect without suppressing the CNS. Robifen is taken orally as a solution, capsule, or tablet. Tablets come in chewable and extended release. Dose ranges from 10 to 30 milligrams every 4 to 8 hours, with a max dose of 120 milligrams over 24. Robifen can be purchased over the counter or by prescription at your local pharmacy. Side effects include dizziness, drowsiness, and nausea. As a nurse, it is important to assess your patient. What is the rate, rhythm, and depth of breaths, assess for cough, and what color the sputum is. Robifen comes in a variety of costs, from generic to brand name, over the counter, or prescription.
Hi Stacy, I'm Starr. I'm just going to go over with you some instructions since your provider did prescribe you some cough medicine, which will relieve your cough, and you can also get it over the counter. You want to make sure you take the drug as ordered. It could cause drowsiness or dizziness, so you want to make sure when driving or participating in any activities that you're going to use your alertness. You want to make sure that you're going to space it out as directed and not taking it right off the back. So like take it at 1 and then take it at 1:30. You will need to report to us if you have a fever, you feel any chest tightness, there's change in your sputum, phlegm, which is clear and then it turns yellow or green. And then if you have any difficulty breathing, if you notice activity intolerance, you notice that you're up moving and then it's just declining and you're just, something's going on with that. Weakness, and that is all I have here. So if you have any questions, you can call us. Do you have any questions now?
No.
Okay, I have this information for you in a pamphlet and I will give this to you and then you can get ready and I can help you get home.
Always consult your doctor before trying a new medicine.
Man, I think that really helped you, did it?
Yeah. It's just unbearable.
Expectorants aid in the coughing up and spitting out of mucus that accumulates in the respiratory tract. This thins the mucus and makes it easier to cough up. Guaifenesin is the most commonly used over-the-counter, called Mucinex. It is generally well tolerated but contraindicated in patients with an allergy to Mucinex. Seldom are there drug interactions, making this a great drug of choice. This drug will provide a more productive and effective cough. This productive cough will help remove excess mucus, foreign particles, and microorganisms, and help relieve chest congestion. We recommend drinking a full glass of water with each dose. These include dizziness, drowsiness, decreased uric acid, stomach pain, nausea, vomiting. You can expect to spend anywhere between $15 and $20 depending on your pharmacy. Use caution in patients with asthma and other respiratory disorders, renal disease, pregnancy, and breastfeeding. Consult with your provider before starting any new medicine. episodes of pulmonary constriction, people with certain types of breathing problems like COPD and asthma.
Albuterol is recommended for children 4 years and older.
Albuterol can also be used prophylactically to prevent exercise-induced bronchospasms. Be sure to use half an hour prior to exercise. Dose range for this medication is 0.6325 milligrams, inhaled up to 4 times a day as prescribed by your provider. Albuterol comes in a liquid to be inhaled by mouth using the nebulizer and is an aerosol using the inhaler. Beta-2 adrenergic agonists' effect on the smooth muscle cause the dilation of the bronchial passages. Albuterol is a bronchodilator that relaxes the muscle in the bronchioles and increases oxygen to the lungs. You can expect to pay anywhere between $30 and $60 for an albuterol inhaler. That's prior to insurance coverage.
Breathing through the mouthpiece while pressing down once on the container to spray the inhalant into your mouth or spacer. Hold for 10 seconds, then breathe out slowly. If a second dose is needed, wait 1 minute between doses. Place the solution into the reservoir. Connect the nebulizer to the face mask or mouthpiece. Use the face mask or mouthpiece to breathe in the medicine. Turn switch to on and breathe.
Available doses are powder, solution, suspension, and aerosol. Common side effects are increased heart rate, nervousness, insomnia, hoarseness, sore throat, and nausea. Patients with chronic asthma are generally treated with a maintenance medication or a long-acting beta agonist, in addition to the short-acting. Patients prescribed the long-acting beta agonist have better results. It's important to remember that the long-acting beta agonist is not to be used as a rescue. Assess lung sounds before and after treatment, monitor vital signs, and contact the provider if there is no improvement. Expectorants and antitussives are commonly used with few side effects and easily purchased. Beta-2 adrenergic agonists are a life-saving drug.